Essential Children's Health Tips. Preventing intestinal worm infections. Welcome to our channel dedicated to children's health and well-being. Intestinal worm infections are a prevalent health concern among children, particularly in regions with poor sanitation and hygiene practices. These infections can lead to a range of health problems, including malnutrition, anemia, and impaired growth and development. In this comprehensive video, we'll delve into essential tips and strategies to help parents and caregivers prevent intestinal worm infections in children. From understanding the types of worms to implementing effective hygiene practices, join us as we empower ourselves with knowledge to protect our children's health. Let's ensure our children grow up healthy and happy. Let's get started. Hello, everyone. Today, we're tackling an important aspect of children's health: preventing intestinal worm infections. These parasitic infections can have serious consequences for children's well-being, but with the right knowledge and practices, we can keep our kids safe. Join us as we explore essential tips for preventing intestinal worm infections in children. Segment 1. Understanding intestinal worm infections. Explanation of common intestinal worms affecting children, including roundworms, hookworms, and whipworms. Overview of how intestinal worm infections are transmitted through contaminated soil, water, food, and poor hygiene practices. Discussion on the impact of intestinal worm infections on children's health, including malnutrition, anemia, and impaired growth and development. Segment 2. Promoting good hygiene practices. Teaching children proper handwashing techniques with soap and water, especially before eating and after using the toilet. Encouraging children to avoid playing in areas with contaminated soil or standing water where intestinal worm eggs may be present. Ensuring children wear shoes when walking outdoors to reduce the risk of hookworm infection through skin contact with contaminated soil. Segment 3. Safe food and water consumption. Ensuring children consume safe and hygienically prepared food and drinks to prevent ingestion of contaminated food or water. Teaching children to wash fruits and vegetables thoroughly before consumption, especially those eaten raw. Providing children with safe drinking water from treated or boiled sources to prevent waterborne infections. Segment 4. Environmental sanitation. Promoting proper waste disposal practices, including the use of toilets and sanitary latrines to prevent contamination of soil and water sources. Encouraging community-based efforts to improve sanitation infrastructure, such as constructing sewage systems and waste management facilities. Participating in cleanup campaigns and community hygiene education programs to raise awareness about the importance of sanitation and hygiene. Segment 5. Regular deworming. Following national deworming guidelines and schedules to ensure children receive regular deworming treatment. Consulting healthcare providers or school health programs for information on deworming medication and administration. Educating parents and caregivers about the benefits of deworming in reducing the burden of intestinal worm infections and improving children's health outcomes. Segment 6. Nutritious diet. Emphasizing the importance of a balanced diet rich in vitamins, minerals, and protein to support children's immune system and resilience against infections. Providing children with nutrient-dense foods such as fruits, vegetables, whole grains, and lean proteins to promote overall health and well-being. Addressing nutritional deficiencies associated with intestinal worm infections, such as iron deficiency anemia, through supplementation and dietary interventions. Segment 7. Health education and awareness. Conducting health education sessions for children, parents, and caregivers on the signs, symptoms, and prevention of intestinal worm infections. Utilizing educational materials such as posters, pamphlets, and videos to convey key messages about hygiene, sanitation, and deworming. Encouraging community involvement and empowerment to promote behavior change and sustainable interventions for intestinal worm control. Thank you for joining us as we explored essential tips for preventing intestinal worm infections in children. By following these proactive measures and promoting good hygiene practices, we can protect our children from the risks of intestinal worm infections and promote their health and well-being. Remember, prevention is key. Don't forget to like, share, and subscribe for more valuable content on children's health. Together, let's ensure our children grow up healthy and happy.